Gautam, Devashri,
Yes, sir.
you can start now.
Okay. Good evening, everyone. The Dr.M.V.L.Kothari Chair and Division of Medical Humanities and Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat Madam, Dean, Sage GSMC and KEM Hospital, welcomes you to the session of reminiscences. Um, Now, I would like to ask the tech team to play the video about the Division of Medical Humanities. Uh, Sage Medical College and KM Hospital will be celebrating its centenary year soon. As we prepare for our centenary year celebrations, we have a short message from our Dean, Dr. Sangeeta Rawat Madam, in the form of a PowerPoint presentation. I request the tech team to please play the PPT. Uh, Next in line, we also have a video message from Dr. Vinita Puri ma'am. I would like to request the tech team to play the video.
Namaste. Welcome to the esteemed alumni of our twin institute, St. G.S. Medical College and KEM Hospital. I am Vinita Puri. I am the professor and head of the Department of Plastic Surgery here at KEM Hospital. I have been at GS and KEM for the last it's almost 30 years now. Today, I'm speaking to you on the occasion of our upcoming centenary celebrations. I think this is the biggest celebration of the century, and our dean, Dr. Sangeeta Rawat, and the faculty under her direct supervision are working to make this event one of the best possible that we can. The role of alumni, the super seniors, seniors, and the young alumni is very important for any institute, and we look forward to your contributions and your thoughts of this festival. The Dean and all the faculty at St. G.S. Medical College and KEM Hospital look forward to your contributions. Namaste.
It is the students, past and present, that make our college what it is. So, as our twin institutes move towards their centenary year, we wanted to give a virtual platform to every batch of GSMC to share their fondest memories of college. Their thoughts and emotions will be preserved forever in the form of these reminiscences. With this, I would like to request the tech team to please display the GAA membership form. To remain connected to our alma mater and informed about the activities in KEM, including its centenary celebration, we request you to become members of the Gosumec Alumni Association, the official alumni body at SAIT GSMC. All the details on how to become a member and this membership form are available on KEM website. All those who are not members as yet are requested to please visit the KEM website. Now I would like to request the tech team to please display the Gosumec alumni slides.
Students. Devashi, that is done. So, student representatives.
Uh, so this is our GOSUNION student team, which includes of our heads Arushi Rajput ma'am, Muskan ma'am, myself Devashri, Gauri, Saud, Sejal, Shikhar, Ansh, Aditi, and Varun. Next, I would like to request the tech team to go to the tech support team. Here we have Mr. Suhas, Tushar sir, and Badal sir.
Today it is Tushar.
Now I would like to request Kanchan ma'am to give an introduction of our today's speaker, M.R.Narvekar sir. Thank you.
Dr. Kanchan?
We cannot
Dr. Kanchan?
Hello, Kanchan ma'am, we cannot hear you. Sir, can you hear Dr. Ma'am? Devashri?
No, I can hear, nor can I see.
I cannot hear Kanchan ma'am. Still not audible.
No, not even seen. Tushar, just check the connection is there.
Yeah. Connection is there, sir. Ma'am, please choose that audio, internal mic of your laptop, or just select and try again. Ma'am, please speak.
Yeah, am I audible now?
Yes, ma'am. Perfect.
And visible also? Okay, great. Then I'll just start again. I'm sorry for whatever technical glitch that was. So today we will be playing a pre-recorded interview of a noted obstetrician and gynecologist, Dr.M.R.Narvekar, sir, which was conducted in the past by Dr. Padmaja Samant, madam, who is the coordinator of our MH Humanities team, and also now the professor and head of obstetrics and gynecology. Dr. Narvekar was born in 1930 and is an alumnus of the 1947 batch of GSMC. After finishing his MBBS, he went on to do his MD in obstetrics and gynecology, also at St. GS Medical College and KEM Hospital. Apart from GS, he had also trained at Wadia Hospital and briefly also at Tata Memorial Hospital. Subsequently, he's also trained at the Mount Sinai Hospital at New York. Sir was an honorary at St. GS Medical College and KEM Hospital and also had a very long and successful private practice. He was very fortunate to work and train under stalwarts in obstetrics and gynecology, such as Dr. Purandare and Dr. Shirodkar. In this interview, Sir has told us about his experiences at GS and KEM, his experiences working with these stalwarts, and also his message to the students of today. So I request the tech team to please play the interview. Thank you.
So, sir, we would like to start from the start.
Okay.
Tell us about. You said your father was a doctor.
Yeah.
Even your uncle was a doctor. You said you asked your uncle.
No. Uncle was in the film industry.
I see.
Manager, not
I see.
working. Manager. But they migrated, stayed on in Madras.
So, where did you live, sir, earlier?
You see, but we stayed always in the same Kamdevi and the Nanachok. That was the area we stayed. From one building to another, another till we settled down in a building called Ishwardas Mansion, where we stayed from 1937. I was born in 30. So from 37 to, I don't know, exactly which year. For
many years.
we stayed there. And then we moved to afterwards, after my finished my education, then we shifted to the present place on Pedagogy.
Sir, what made you take medicine as a career?
Well, I would tell you, medicine as a career came almost as a
Accident.
No, not as an accident, as a routine thing that was going
It was to happen.
because my father was there. So that it happened that way. But then there was an interruption in between. You see, when I was working at Elphiston College, I was first year student and all that. There used to be a next door thing, institute called Royal Institute.
Yes, I know. Institute of Science. Now it's called Institute of
We have
Science.
called RS.
Yes.
Royal Institute. There we had a friend, you see, who used to work on cathode ray tubes at that time, research.
Oh.
And I got interested in that, and he got me into it. So after doing the work, thing and all that, I used to go and sit with him for sometimes for hours, taking all readings and all that. And I told my father one day that if you like doing the engineering. So, you know, my father and Dr. Shirodkar,
Yes, I know. Yes.
They were together in colleges in their colleges.
Okay.
He said, we went and told Shirodkar. He gave me such a firing of what they were trying to do, join the medical college. That's a simple way I joined the medical college.
Okay. So, you were in JJ or you were in
KM?
KM.
Oh, yeah.
Okay.
KM.
So, from.
But I was, when I finished my inter-science, I was 16 years old. So there was no admission. So they told me that you will have to come after 1 year.
Okay.
Well, what waiting 1 year at that time used to be so hard. I tried to go and apply for MRC.
Oh.
Medical.
You did your BSc.
Yes, that's right. So for 1 year,
Many people did that.
So then I went to BSc in St. Xavier's College.
St. Xavier's.
And did my biochemistry.
Okay.
And that one thing I still feel that, you see, every medical person, I think, is far better suited to things if he does biochemistry first. And then comes
The basic of pharmacology.
Yeah, I know.
Even medicine for that matter.
No question at all. So that was the thing. But then I joined the medical college here. No difficulty in getting admission or that because of the marks. But after that it was smooth here.
And do you remember any of your teachers of that time?
Well, I remember not the name, but I remember every teacher and they were really good, I can assure you. And Professor of Anatomy I still remember. Because I met him many years later in South Bombay. University I today. Which anatomy professor of degree. But I just don't remember the name.
Dr. Kopika? Dr.
Kopika. He was the. And one of you was the way he had a way of teaching. And it is a very daily subject. But he had a way of teaching things. So that he was. I mean, I was lucky. I think I got a best professors.
Best teachers.
And the teachers every time. So that was that. So it was afterwards a regular medical career.
And how was KM that time?
It was a much simpler affair. Yes. I mean,
And a majestic building.
Yeah, a very well kept and building, not as crowded and everything like this. And well, I mean, I don't think I missed anything as far as basic college is concerned. And all of us, none of us, so that very nice. And we used to be rated far superior to any other college in Bombay. Everybody who passed his inter-science with the highest marks used to be always waiting for 2K or so. So that was the thing. It was very nice. I mean, it was at every stage you got to teachers and all that. They used to be very good. In between, I went for my junior basic biochemistry to St. Xavier's College before I joined. They were also good. I remember those professors actually were Dr. M.R.N.Kothari, professors of biochemistry. Oh, they were very good also. Afterwards, I went there and attended some of my students quietly sitting in a class. But they were not that impressive. Whereas for impressions change after many years.
And sir, then you took gynec because.
Oh yeah, then this, my changing from physics to medical career. And then afterwards, post then after I finished the thing and all that, the question of doing is what to do.
Post-graduation.
And I was very inclined to neurosurgery.
Then what brought you to gynecology?
Dr. called me and said, look, okay, exactly these words are. Really, you are correct.
He was a gynecologist.
Afterwards, there was nothing I could say. But luckily, at that time, the rules were about before you got into after MD and all before you.
I'll give it as
So I went into gynecology and worked with the best of people. Came in training for the first time under Dr. Masani, but Dr. Kothari was assistant. So worked with him at Gosumec, then came hospital and worked under
Dr.M.V.L.Kothari himself.
Then I mean at that time we had to finish those and all. And then before that I sort of finished my.
When did Vadia come up, sir?
Vadia was there at that time.
There at that time.
Vadia was there at that time.
Vadia was there. And if I.
I worked at Vadia.
Achha.
I did my housemanship in obstetrics in Vadia.
And Vadia used to have a huge number of deliveries at that time. And
but what he tells me, he says that nowadays they are used to be 1,200, which we never reached at that time.
12,000.
12,000 rather. It's nothing that we reached at that time. Ours used to be around 9,000, 10,000 and all those. It was not 12,000. But anyway, we used to be there. But the references were mainly from surrounding hospitals.
it was like a tertiary care center.
Care center. Everything, with severe bleeding, the collapse and all that, Vadia hospital. This sort of thing. But that is, how it ends. You remember that one of the things I remember still, I became registrar after passing. So I became registrar and came here in obstetrics. But believe me, my first night here, the case was referred to from somewhere. About 8 months pregnancy, placenta previa and bleeding. Then cervix for 1 centimeter diameter. My boss was here. I rang him up. I thought that he would take some time to wake up and all that. Ring up, hello. Not one, so they said, wait a minute of wait. I told him this is that. Or put it in the placenta and put on the. So I think I didn't sweat it so much anywhere in my life. But then once you did such things, you see, there was no anything was all right for us. But the way of teaching and all that, words only, but I was lucky to have the best teachers. BNN and was
Sir, I don't know, I am not from KEM, so I do not know, I have heard about it, that earlier mainly gynecology cases were in KEM and obstetrics was more in Vadia.
Absolutely, yeah. Always there. And we did the gynecology there, but gynecology also, I had a best time working with BNN and all that. We used to do cancer surgery regularly. Because I worked at Tata, but very regularly, at least one case a week was there of Tata.
So you joined Tata Memorial after you finished your MD?
I think before that, after
Tata.
Yeah. After between registarships.
Between registarships.
Yeah, I joined.
So that was like a locum for somebody, or it was like
locum, somebody left.
somebody
So
left.
that's why, otherwise I would have been just watching. That I was going to go there, but just watch and all that. But because one of them, somebody left early, I got I could complete a course of 4 months. So I worked there for about 2 months. But that was a great experience because after coming here, there was no dread at all of operating on cancer patients.
And so, who were your colleagues here in that time in post-graduation?
Well, you'll be surprised, but there was some restriction at that time about going to America. And there were some rules where to go and all that. Now, suddenly at that time, one particular examination was instituted for admission there.
ECFMG.
Or something like that. That examination. Do you know that 90% of the students totally from they migrated?
I see.
Because they got the admissions there and for some years, when first of 1 or 2 times when I went there, I used to meet so many of them. Now they are all dispersed in America and so. That was. So there are very few of it. At the present moment, from my class, I have only 3 students in Bombay who are my classmates.
So you never felt like going and studying and practicing abroad? Since your whole batch went.
No, that's also a story.
I
You
see.
see what happened, my brother left for England, younger brother, left for US in 1951.
He was also in medicine.
No, he was in economics.
Economics.
So he went there. And as soon as he went there, he joined the college and all that. And he was supposed to go there early, finish his degree, and then I was supposed to go. His boss became a member in the International Monetary Fund.
Oh.
He insisted that he came there, my brother. And he pulled him out of the thing and all that and took him to the International Monetary Fund. So that was, so once he got in the fund, there was no way
He couldn't come back.
come back and so I was there.
You have done your MRCOG part 1 and all that.
So part
Sir,
1,
yes, done.
I finished part 1, thesis, everything was done.
Acha.
And then his father fell ill, that's why he didn't go.
Then my father, somebody had to stay in
Had to
India.
stay here.
And then my brother couldn't because of the job he got.
Yes.
So that's why I continued to stay here. I went in 1970, I think, was the first time. And that was for the
Colposcopy training.
Mount Sinai Hospital, and that's what we were doing.
And sir, your wife is also.
No, she's not doing in medicine. She was in RPA and everything. She was doing that.
And you started then private practice at what time?
When I started practice almost immediately because I started working with
So you used to work with him in his.
6 o'clock in the morning.
I see.
Assisting with our operations and all that and get out at about 8:30. Then I got the attachment to KM immediately.
And that time it was mainly honorary-ship, no? There were no full-timers.
No full-timers. So there was the thing that they were there and I had really high marks. So my admission was no problem. I didn't come for interview. They didn't call me for interview also.
They gave you an appointment directly.
Doctor, somebody was there, but his name was Lee. Yeah. So, just came.
So tell us something about Dr. Shirodkar.
Oh, Dr. Shirodkar.
Since you have seen him so closely, like your father's friend and then your mentor and...
Yeah. You see, Dr. Shirodkar, you'll be surprised, was not a gynecologist.
General surgeon.
General surgeon. And because of some, he was working with, I don't know whether you name Dr. Narvekar and Dr. Wellington. He used to be one of them. And there was some problem with the family and all that, because they are all related people, the family and all that. So he shifted over from some other specialty to gynecology. And to be believe me, he excelled in that, that.
Yes.
At that time, Purandare and Shirodkar were the only 2 names. And
one JJ name and one KM name.
Always that was the standard thing. So he told me, he asked me to come. So as soon as I finished, he asked me to come and assist me at 6 o'clock in the morning. He used to start. I had to be there 15 minutes before he came. And the usual thing, after finishing most of it, that was the story. And that lasted for about 3-4 years. But that was a great thing because I saw what Dr.M.V.L.Kothari's operation and his operation. Dr.M.V.L.Kothari was, I would say, a little very good self and question. Both of them were, far above average. But this was a delicacy, and that was a sort of, the rough, quick thing. Two different things. But it's worthwhile watching both the types, totally different types of surgery. So I was lucky to see all these types, you see. And the person who sort of copied just like me, copied just both of this operating was V.N.Kothari. V.N.'s younger brother.
I see.
He joined, we used to be sort of very close when we were here. Every sort of, some new subject and some new article would come, hearing campus. And then we used to sit in the honorees room, all to discuss what they go. We had a great academic time.
Sir, the downstairs honorees room near the administrative office, or it was in our department?
No, that whole thing was not there at all.
Our wing was not there.
There was the first floor, now opposite the GOT, the gynaecology.
That wing was there when sir was there.
We used to sit there.
GORC almost there, everything was there. The thing used to be, the honorees room used to be just opposite the
gynaecology, what is there today? I see.
So that was the standard place. We used to sort of discuss, every he used to choose the subject, and then we used to discuss for hours together there what to do, how to adapt here and all that. It was the time that Mutasha used to be there at that time.
Dr. Zobrekar.
But she never used to sort of join us, and she used to be very eager to leave home.
Sir, what were the dynamics between doctors and nurses at that time? Because now, I'll tell you why I am asking you this question. Today we find nursing and doctors, two branches or two groups of personnel. They don't work in synergy or together. So,
but you see, I think if you sort of observe, you will find not all of them belong to the same category. Some of them are there who will cooperate with you and see in a few days you will understand that they look out your way of looking at it and they do the same and all. And in some you see it's doing the work and getting out of it. That sort of attitude is there. So, I mean, it's I think the same thing. I can't imagine this.
Because it was much later, but when I was student also, we nurses had a unique place in our management of wards and all that. And Dr. D.D. Sathe was my first boss in residency, and he used to, like, sister would order him, sir, apron nahi ghatla. And sir would go back and wear apron and come. So the nurses were that time were very...
No question. The senior nurses did exactly that. And we didn't mind it at all.
Doctors didn't mind, yes.
Mind at all. I mean, they say everything. And whatever we did, I mean, we think just always looking out to help us, particularly with junior. But that culture is everywhere. You see, I went to Australia, you will be surprised to see and went to there because they wanted to start IVF.
In here?
Here. No, not here. In private.
Your center.
And that was, I didn't want to learn the technology of that, but to set up the laboratory. Yes. And I show that, see, for each time the laboratory and all that. The way those nurses help me about everything. How to treat the instrument, how many inches from this, how many inches from that, all that thing. It took me about, say, 7-8 days to, but the operation was just unusual. They didn't know me, I didn't know them, but just very nice. It's unique. But that was the same way. I mean, I find, I don't think you can sort of categorize them as always good and always bad. Some of them are bound to be there always ways of behaving. But some of them you could get out of very, very well. And see, everything is down so far. You know that, see, we were, I was last week sitting up the whole night previously, that I'll call you. So that's something. And some of them were really good. I mean, they would say, oh, the doctor, she wrote it. You won't tell us directly that you do this. They used to do it. That was the, but if you sort of once show them that we are prepared to let and not try to pass over them, oh, it was just poor health. I personally never had any problem with it.
Sir, any memorable cases or something that you felt very happy about, or something that you did not work out and you felt very bad about, or something of that sort?
Perhaps it was there, but I don't really remember those cases. Not really, I can't.
Can I talk, or it will get this thing? Should I?
Yes,
it will get. I'll just tell a case of his, okay? Not my case, Tenchi's case. There was a patient who had, it's about 30 years ago. Patient with a placenta previa accreta. That time, and with hematuria passing. And at that time, literature mortality used to be about 70 to 80%. And it was referred, she was this commissioner, one of the commissioner's wife. So she,
the patient herself.
Patient herself was a commissioner's wife.
Okay.
Not municipal commissioner, one of the working in the airport. So anyway, so he was brought, and we decided that time the question of going to big hospitals didn't arise. He operated in the nursing home. So that time, delivered the baby, retained the placenta, gave the patient danazol. Danazol had just come in, and patient
turned out fine.
Patient went home after 2 months. The placenta came out. The funny thing is, 1 year later, she came with a cake with the baby to meet him and thank him, because she realized the gravity of the situation. She went home that day, and that day she just went home, lit the match in her kitchen. There was a gas leak, and she died on that day. 1 year later, to the date. Lydia Khan, I know her name also, I remember, because she had this, that first time she was supposed to die on that particular day. She didn't die, and 1 year later, she died on that same day.
But everybody was saying, I was going to leave the placenta there, I'm going to leave that. Why should I try to interfere with it?
Yes.
I closed it and sort of, and immediately started the and she just, nothing happened.
That brings me to that, I have heard about it. Dr. Purandare used to chart patients' horoscope.
The BL, you see, in the later years, he was a little bit not quite academic, I would say.
He used to, this is what I have heard, that he used to plan things according to the...
And write poetry. I once went to it's a small thing, I'm not degrading him for a great surgeon, but once I went to a function, and there everybody knew that I was working with. He used to be at that time trying to sing also. So, these are all well-known literature people, and well-known literature, Marathi literature. And my original this was the boss at Purandare, त्यांना सांगा की गायनेकॉलॉजी आणि गायन यात काही संबंध नाही. What I was told. education thing, but afterward bridge. And to some extent, the four of us were deciding to start a bridge magazine.
Oh.
I tell you the names, Dr. Kher was a professor of anatomy.
Oh, Hadar Kher.
No, not
Or his father. Manohar Kher. Then he was in Sion also. Shakiran's husband, no? He was our anatomy.
Then number two was one Dr. Vora, who also became a professor of anatomy. Vora. And third was a person who became a urologist afterwards, gave it up. No, not Patki. Desai or something, I don't know. But I forget his name. But
So you people were so good at bridge that you wanted to
start a bridge magazine. But then as the examination approached, we decided that it was not possible. So they both of us, because they wanted to go on with bridge, they didn't take up any clinical medicine. They took anatomy. Both of them became professors of anatomy.
Dr. Kher was a classmate.
My classmate.
Oh.
He stood in the MBBS exam, MBBS examination. He stood first and I was second. He stood first.
He was translating Gray's Anatomy, I think.
No, that I don't know. But
Yes, because when we were students, I was in Sion and he was HOD of anatomy there, and
maybe.
he was.
No, he was. I tell you, one of the most intelligent fellows I've seen.
That was his project, translating Gray's Anatomy.
He made a name in bridge also. He was a very well-known and top bridge players in Bombay.
So, sir, you joined in 1947 college.
Medical college, yeah, because I had to wait for 1 year.
Yeah, so 1947. So you, Dr.M.V. Kher and all joined in.
Yeah, at the same time. See, we were there, 52, all of us passed in 52, and our postgraduates in 55. But we got off that bridge business. we
continued.
We continued. He also became Professor Vora. He became Professor of Anatomy. I think he was in Nair Hospital also.
Sir, over so many decades of your practice, did you notice any change in the way patients look at doctors?
It was a tremendous thing. Very tremendous. No question. But I'll tell you something. I'm not a person who can sort of define what the way they look.
It's a perception, no? We all at least we perceive.
Yeah. You see, demanding things from, I would say, if you want to summarize the whole thing, demanding things from doctors is one thing. Luckily, the hostile part and all that I never encountered, luckily. Just lucky. Or perhaps it was too early. But this demanding things and all that was not very common thing, but now it is rampant. So, one of the things you see which made me, I retired from KM because of so many these things only. Because first of all, the atmosphere has changed, you see. I was getting more busy with private practice and all that. So I didn't think I was doing service here. So I took my retirement.
It will try prematurely.
I tried about 2 years, not
3 years earlier.
2 years earlier. I thought it was better too much. So,
Over a period of years, priorities also change, you know. And we can't really do justice to
there are 2
everything.
nursing homes over there and consultations twice, 2 places. Plus I was working with our...
There were 3 nursing homes. There were 3 that time.
No, 3 at that time, yeah. And plus I was working for other doctors. Yes.
So, over a period of the same way as there was change in patients, how have you seen medical education changing?
Say, because I myself see what happens is, you see, once or twice I deliberately went to attend some lectures where I was not supposed to do. In years I know that also. But the whole thing was little it a different way. They taught them more. For example, I'll tell you, the way sort of some people taught was, they taught from the textbooks. They taught about the same way, but they taught from the textbooks, one thing and all that. Whereas there are some others who did not talk that way. Now, one of the people, I can tell you that when I appeared for my MD, there are so many professors attending lectures. I attended only one person. And that, if you'd be surprised to hear, was one Dr. Saray.
Sorry.
His master thesis.
100 years, he died
Yes,
100
I
years.
know.
We used to go and see him even now.
Yes.
He's similar, once he has come with the subject. We are discussing today such and such a subject, present or previous. You know all of this, I know that. But you sit down and tell us exactly what things to read from. And the only person I attended with my entire MD learning was Saray. He gave us exactly the details of what. The same thing when I registered for my MD, Shirokar called me. Joy Dhar ne मैंने पढ़ा पहले पैथोलॉजी का पुस्तकांत ते पाठ कर रहा हूँ. That means he made me learn the textbook of pathology first. When you finish it and then start to volume clinical and all that. It was a straight advice. This is thing that advice that you don't get now, and it is very necessary. You have to go to medicine without doing biochemistry. I feel how people do it, because they must be now including the same thing in the subject. But in gynecology, I don't think anybody does.
And now sir, tragically what has happened, first year has become only 2 terms. So that is even bigger burden on students.
But he told me before joining college to finish your pathology textbook. This was there was one textbook, English, some Englishman's textbook, that was standard at that time. And talking of 70s. But that was real advice, you don't understand how easily you can understand what is happening to patients and what may happen now. You don't have to be told once you are reading the books. Anyway, I would generally say that I was quite lucky with my teachers.
What about students?
Students, there are many, but see, unfortunately, I'll tell you, the contact with students was not that low. For example, you're talking of Dr. Gosumec, who met me at for some test of mine. I went you were my teacher. But that was how many years ago. He is there in the department at Vizcaya Hospital. So, there are many, and many of my colleagues, you see, who were there at the time, particularly in the class and all that, they almost all migrated at that time. Yes. So that was the time when it was easier to do, not as expensive as now. And the GOSUNION hospital has a tremendous reputation there in US. Admissions for GOSUNION students was not very difficult.
Difference between practicing and private practice.
Sir, what is the difference, or what was the difference that time in practicing in KEM and practicing in private?
As soon as this going to it, it's a class of patients.
Yes.
And the diseases they suffer and all that, they're totally different from what they see us in private. Tremendous difference. So literally you can't sort of very well compare that. So, I really can't answer your question precisely or thought of these type of things. But of course, the economic condition of their board is different altogether there. That also creates a difference, I think. But apart from that, what diseases they had and what things and all, like endometriosis and other things in private practice, and fibroids and infections in hospital practice. Public practice was a standard thing. But then I really can't differentiate these two things because I have thought in those terms.
Sir, how many siblings are you people?
Two brothers.
Two brothers. So you wanted, or you naturally it happened that you came into medicine, or
Same thing. It was everything around the house was about medicine, so never thought about anything else.
So the same thing. My younger son, his brother, he became a dental surgeon.
dental surgeon.
He migrated to US and then he joined the college and all that. He retired as
Not retired. We came back in '95 after he was there for 10 years, and then he came back and now he's practicing here.
Had you not become a doctor, what would you have become?
This time physicist.
Physics. Oh yes, you wanted to go to Institute of Science.
Definitely got into that.
What do you do now, sir, presently?
Currently, there are certain things we do.
He likes to travel.
We travel more. I mean, weekends, because these days in the week I spend outside.
Which is your hometown? Means native?
You see, if you ask me that way, Karnataka, Goa. My mother is from Goa and my father is from Karnataka. The mother tongue was Kannada. And my mother's mother tongue was Konkani.
What would be your message to today's teachers and today's students?
I really can't think about it suddenly because a message is always well thought out and something that appeals and people remember. I really can't.
No, not in precise words, but
one of the things that I always thought from my best teachers was that just teach what is written in textbooks is not the way to teach at all. Because the books are there for them to read. I mean, where is the idea in trying to sort of go in that order and teach and all that? That's not the way to teach. You have to sort of give them the idea and then see that they refer to those things and
so like Dr. Saraiya taught.
Yeah, like Saraiya, yeah. No question. Yes, they used to come. Then he would ask us, what about this question? Can you answer this question? No, just no. But you'll find it somewhere. Somewhere. I always attended his lectures for MD. And what he did also was revised all the questions that came from universities, not even in Bombay, but elsewhere. And then such questions, what will you answer? This sort of thing. And then give the one point how you would answer that. His way of teaching was something totally different, and I was lucky to have him there because it just fitted my way of thinking. But many of those people, I attended once or twice and all that, but they gave what was given in the books, so there was no point in attending the lectures and all that.
And there used to be, that is what we have heard, that there was a lot of rivalry between JJ and KEM at that time, and maybe much later on, but between Sion and KEM and all that. But Sion was a small fry.
But that applies to all colleges, right, starting from first year science.
Okay.
We went to see
cricket.
See cricket, and I was in Christian college, so the others used to say, Fodkar was fought out in something. Ding dong bell, Fodkar's in the bell. So these things crossing go on, but I don't think it has got any meaning. It's just a question of.
But that time I think students used to be quite afraid. Oh, examiner is from JJ, so now I have a problem. Or examiner is from KEM, I have a problem.
But I don't think we had any time. I don't think. Yeah, either there was that I don't think there was much discrimination or anything that they would sort of follow anything. I don't think so. I think you can see that for, and I think the examiners and all at that time when we were there and all that, they were senior people usually, because the numbers were not that many.
How many students were there in your batch? If you remember.
Oh, my batch, 81. And but they, no, I think the teachers at that time, you see, there are some of the teachers, for example, people now, they change their things, they shift from one place to another and all that. The constant at one place is not very common. They get a higher job somewhere, they would go there.
And actually now there is pooling of students also from all over the country. They come to different cities.
But we also get students from outside. But it is here difficult to get into KM. Temple not easy.
It is progressively become more difficult.
Yeah, I think so. It must be difficult. Because you see, one thing I'll tell you, KM has developed its reputation not only here but abroad and in America. I can tell you. We are from here, KM Bombay. Patient asked. I'm talking of not now, 40 or 50 years ago. I remember going to Mount Sinai Hospital the first time I went there. Which college are you from? Okay. See, some things that were accepted immediately. You always be lucky to sort of be starting off with career, spending your time in mental institutions, best teachers.
So you met senior Purandare?
Yeah, he was his teacher.
You have a
He was telling his stories.
About senior brother. No, I'm not talking of him. She's talking.
No, main.
N.A.
Purandare. Oh my God.
Because we have that Purandare.
Yeah, that's right. I can remember the
GORC.
story. He and Purandare finished his British training and everything and came here as assistant manager. Me and Purandare.
Yes.
We were registrars or something, also registrars or something like that. He was an old man, but highly respected in Bombay. He walked along and all that. आमचा ह्याला जरा बघा तुम्ही पोरकट आहे तो. This is what we were told.
What is the word for?
Porkat means stylish.
These are his words. We came here. I was a houseman or something like that, listening to them. He just came. He was highly respected. Here also, when he came, everybody was behind him. Already you were here at all.
We have his photograph in our archives because of that center.
Yeah, he must have come for some function or something. And why he had come at that time, I don't know.
No, sir. This entire laboratory is in his name.
GORC laboratories, and that the family, I think, donated funds.
Yes, I mean, he was. I mean, at that time, really well respected, and really totally above any malpractice or anything. This great reputation that continued afterwards. But he was at that time. It was really bad, not so. And respectful is knowledge also, which of course afterwards we found there was many variation. But that is the progress over a generation. So I'm saying, there you are. He set a good precedent for professional etiquettes and all that. He was very old. I don't think he was practicing, but as he told us,
And sir, to today's students, what would you say?
No, but I don't know. I'm totally out of touch with all these things for so many years now, and I have no idea what their way of doing things and all that. I really can't comment on the students and what their ways of doing things also are. So Anyway,
We'll show you that archives. You have some old photographs or something which we can, besides of course now this thing.
I'll give you a small write-up. I'll give you a small write-up about the laparoscope when it was given to him. And
She's asking about if
the photographs. The photographs
so we can
are
take
also
copies of.
I'll just
Yeah,
say I
those
don't know whether.
photographs will return. We'll just
Well, I'll just find it. I don't know whether he has them, but we'll have a look and see. I'll ask my mother. My mother would probably
you see, actually,
know whether.
also the department at the time was a complete development, going out to starting into endoscopy, going colposcopy, then shifting on to laparoscopy, and then starting on to operative laparoscopy. So all this, you see, somewhere people like us who are working there also, we lose our way in their progress.
And when IVF started here, sir was here when Dr. Hinduja started.
I was there, but you see,
Not associated.
Not associated with them.
But you started it in private.
No, he started.
You started in the sense you people started in
1988. It started in
88.
He started. I mean, I don't think I know much about that theory.
Take archives.
Thank you so much, sir.
Thank you.
Now I would like to request the tech team to play the reflections video by Dr. Swarupa Bhagat. Ma'am.
A very good evening to you all. It is indeed my pleasure to speak about Reflections on Medical Humanities, annual volume published by Dr. Manu.V.L.Kothari Chair and Division of Medical Humanities, Gosumec Alumni Association, under the patronage of Dr. Sangeeta Rawat, Dean, St. G.S. Medical College and KEM Hospital, Mumbai. The first issue of Reflections was published in the year 2019, the theme being History of Medicine, Looking Back to Improve the Future. The book comprises invited essays, poems, cartoons, quiz, crossword, and articles which were published before in different medical journals on evolution of branches and development of specialties in healthcare, great personalities and inventions in medicine and healthcare overall. The issue for the year 2020 was based on interpersonal relationships in healthcare. Again, invited essays and cartoons on doctor-patient relationship, doctor-doctor relationship, and medical teacher-student relationship were included. For the year 2021, we chose very apt theme of COVID-19, the human angle. Essays and poems in English, Hindi, Marathi, paintings and photographs contributed by teaching and non-teaching staff and students of St. GS Medical College and KEM Hospital who shared their experiences both on personal and professional fronts during the pandemic. The theme for the year 2022 was literature and medicine. It is a collection of articles, book reviews, and poems in English, Hindi, and Marathi, and also paintings and cartoons related to the theme. Now, for the years 2023 and 24, the proposed theme is Reminiscences, Our Days at St. GS Medical College and KEM Hospital. As we move towards the centenary year of our institution, let our fond memories come alive in the form of nostalgic writings about our learnings, not only medicine, but also life lessons that we learned here. Let us talk about our devoted teachers who inculcated values and shaped our lives, priceless friendships which we cherish lifelong. Our writings will instill a feeling of pride and a sense of belonging in all of us. The readers of the book, we as well as the future generations of students, will understand the power and beauty of expression and reflections. We will be enlightened about the history and glory of our institutions, past students who have contributed to the welfare of the society, and the role model teachers and mentors. We know, irrespective of the generation, we are bound by a common bond of being GSites. However, we also need to accept and adapt to changes which are inevitable following technological advances and societal transformations. At the same time, the students will learn that even though the changes are occurring, the humanitarian values and principles of ethics are unchanging. Hence, we appeal that the reminiscence and nostalgic memories shared on this platform of virtual reunions be expressed in the form of writings to be included in our next issue of Reflections. I, Dr. Swarupa Bhagwat, Editor Reflections and Associate Professor, Department of Transfusion Medicine at this institution, will be privileged to connect with the individual batch coordinators for sharing more details regarding the same. Thank you very much.
Now, as we come to the end of today's meeting, I would like to thank our Dean, Dr. Sangeeta Rawat Madam, and Academic Dean, Dr. Pathak Sir, for their continued support and encouragement. I would also like to thank the Gosumec Alumni Association for administrative support for correspondence and financial transactions of Dr. M.V.L.Kothari Chair and Division of Medical Humanities. For today's interview, I would also like to thank Dr.M.R.Narvekar sir and Dr. Padmaja Samant for helping to take the interview, due to which today's meeting has been possible. I would also like to thank Mr. Tushar and Mr. Badal for audiovisual and technical support, and Dr. Mhatre for video recording. And at the last, I would like to thank all the participants of this meeting for patient listening. Thank you.